Section 1. A new generation's nicotine, snus, and its growing popularity. Snus, a smokeless tobacco product, has gained significant traction, especially among athletes. Unlike traditional chewing tobacco, snus comes in small pouches. These pouches are discreet and easy to use, placed under the upper lip. Snus delivers nicotine, a highly addictive stimulant, without the combustion of cigarettes. This discreet method of nicotine consumption has made snus popular among athletes in various sports. Footballers in particular have been drawn to snus for its perceived performance-enhancing effects. The nicotine rush can lead to increased alertness and focus, qualities desirable on the field. However, this seemingly harmless habit has sparked debates about its potential health implications. While snus eliminates the risks associated with smoking, such as lung cancer, it is not without its own set of concerns. The long-term effects of snus use are still being studied, leaving athletes and health experts to grapple with its potential dangers. The use of snus among athletes highlights a crucial point. The pursuit of performance enhancement often intersects with health risks. This complex relationship raises questions about the lengths individuals go to gain a competitive edge and the potential consequences they face in doing so. Section 2. The athlete's edge or a silent threat, snus in football. Football, with its demanding physicality and strategic intensity, pushes athletes to their limits. The desire for an extra edge to outperform and outlast opponents is a constant motivator. Enter snus, a discreet and convenient way to deliver a jolt of nicotine, promising enhanced focus and stamina. Footballers, particularly in European leagues, have embraced snus as a common practice. The perceived benefits, such as increased alertness and reduced stress, are enticing in the high-pressure world of professional sports. Teammates often share snus, normalizing its use and perpetuating its presence within the football culture. This normalization, however, masks the potential health risks associated with snus. While not as harmful as smoking, snus contains nicotine, a highly addictive substance with its own set of adverse effects. These effects include an increased heart rate, elevated blood pressure, and potential cardiovascular complications. Moreover, the long-term consequences of snus use on athletic performance remain largely unknown. Some studies suggest potential impacts on endurance and muscle recovery, raising concerns about the sustainability of using snus for enhanced performance. The lack of comprehensive research leaves athletes vulnerable to unknown health risks, a gamble with potentially career-ending consequences. Section 3. Snus versus traditional tobacco. Weighing the risks. Snus, while often grouped with other tobacco products, differs significantly from traditional cigarettes and chewing tobacco. Unlike smoking, snus does not involve combustion, eliminating the risk of lung cancer and other smoking-related respiratory diseases. This distinction has led some to consider snus a safer alternative to smoking. However, it is crucial to remember that snus is not harmless. It delivers nicotine, a highly addictive substance that affects the brain and body. Nicotine addiction can lead to dependence, withdrawal symptoms, and difficulty quitting. Moreover, snus use has been linked to an increased risk of pancreatic cancer and other health issues. Compared to chewing tobacco, snus poses less of a risk for oral cancer. Chewing tobacco contains higher levels of carcinogens that directly impact oral tissues. Snus, while still containing harmful substances, is placed under the lip, reducing direct contact with the gums and cheeks. Despite these distinctions, it is essential to approach snus with caution. While it may present lower risks than smoking or chewing tobacco, it is not a safe habit. The long-term effects of snus use are still being investigated, and its impact on overall health, particularly for athletes, requires further study. Section 4. Expert Opinions. Unpacking the snus debate. The increasing popularity of snus, particularly among athletes, has ignited debate among health experts. Dr. Anna Solberg, a cardiologist specializing in tobacco-related illnesses, expresses concern about the normalization of snus use. While it may be less harmful than smoking, she cautions, nicotine in any form poses health risks, especially for athletes. Dr. Mark Johnson, a sports physician, points out the lack of long-term studies on snus and athletic performance. Athletes may be drawn to the perceived benefits, he states, but we need more research to understand the potential impact on endurance, recovery, and overall health. Anti-tobacco advocates argue that the normalization of snus use, even among athletes, sends the wrong message. They emphasize the addictive nature of nicotine and the potential for snus to act as a gateway to other tobacco products. The debate highlights the need for more comprehensive research on the long-term effects of snus use, particularly among athletes. Clearer guidelines and regulations are necessary to inform users about the potential risks and benefits, allowing for informed decisions about their health and performance. Section 5. The final whistle. Balancing performance and health. The use of snus among footballers presents a complex dilemma, highlighting the delicate balance between performance enhancement and health risks. While snus may offer a perceived edge on the field, its long-term consequences remain largely unknown. Athletes, driven by the pursuit of excellence, often find themselves navigating a gray area where potential benefits intersect with potential harm. The normalization of snus within certain sports cultures further complicates the issue. Teammates, coaches, and even fans may unknowingly perpetuate a habit that poses health risks. This normalization underscores the need for open conversations about snus, its potential benefits, and its very real dangers. Education and awareness are crucial in empowering athletes to make informed decisions about their health and well-being. Understanding the addictive nature of nicotine, the potential for long-term health complications, and the availability of safer alternatives are essential steps in promoting responsible choices. Ultimately, the decision of whether or not to use snus rests with the individual athlete. However, it is a decision that should be made with full awareness of the potential consequences, ensuring that the pursuit of victory on the field does not come at the expense of long-term health and well-being.